Mimi, which is your favorite color? The red? I agree with you. From a very young age, we teach our children how to read, how to be kind, and how to draw and create art. But it's also very important to teach them how to have a very healthy lifestyle, to eat better and to work out. So as we teach them the basic necessities of being a human being, let's also teach them how to eat, how much to eat, and how often to eat. Because these are habits that will formulate and become parts of their personalities, and they will carry them into adulthood. So let's give them the tools and the keys to make them lead healthier lifestyles.
Hi, today I would like to talk to you about a very important disease in the community, which is diabetes. Diabetes is a medical condition associated with elevated levels of blood glucose levels, and that would create a bad environment to the body, and it creates a lot of complications and conditions. Diabetes is a medical condition that is very widely popular in the whole world, especially also here in the Gulf area and also in Kuwait. Diabetes is a condition related to the elevated levels of glucose, and that's because of several mechanisms and several causes. Now, diabetes could be something inherited and could be also something acquired during the lifetime. There are several types of diabetes, all of them associated with high levels of glucose in the blood. And when that happens, several complications and problems could develop. The types of diabetes could be what we call type 1 diabetes, which is a disease of diabetes or a type of diabetes that happens usually in people at early age of their life, especially in kids and teenagers. And when it develops, it usually means that the pancreas in these kids and these teenagers, which produce insulin, which is a hormone that regulates the glucose levels in the blood, actually is damaged or not producing enough of the insulin. A lot of these conditions is because of some sort of inflammation that happens in the pancreas, and that inflammation makes the function of the pancreas abnormal or reduced, and that would reduce the level of the insulin being produced in the blood, and that's why diabetes develops and elevated glucose levels happens. You always need insulin to regulate the glucose levels in the blood, and when you're missing the insulin, and that's when the problem happens with type 1 diabetes. You have always high levels of glucose. There's we call also type 2 diabetes, and this is the larger in terms of percentage or the widely most common type of diabetes. And this type of diabetes, which is type 2, it's a complex in terms of how it actually happens. Their genetic backgrounds could cause it, and also lifestyle can cause it, and that's very important too. Because lifestyle that is based on obesity, and increase in weight gain, reduced exercise and level of movements and activity, and also the diet that is very rich in calories, very rich in carbohydrates and refined sugar, all these things will induce a state of what we call of insulin resistance, is that people will gain weight. They will consume a lot of food that has a lot of carbohydrates and also calories in general, and that will create some sort of resistance to the action of insulin. So people with type 2 diabetes, they don't have, initially at least, they don't have a decline or a deficiency in the insulin level, but they do have insulin resistance. So the insulin will not work properly and will cause elevated levels of glucose. Now, these are the most two common types of diabetes that could develop. There's also other less common types of diabetes could happen. There's something we call pregnancy diabetes or gestational diabetes, which is a state of condition of elevated glucose levels, which is also diabetes, but happens during only conception, during pregnancy. And we'll talk about it more after the break. Welcome back. We stopped when we were talking about gestational diabetes, which is a diabetes related to pregnancy. Because in pregnancy, there's a lot of hormones becomes active and levels of these hormones becomes very elevated, part of normal pregnancy. These hormones could have also a counteracting effect on insulin level and also on insulin action. So insulin resistance can also develop during the pregnancy period, which is very similar to what happens in type 2 diabetes, but the cause is different. It's because of a pregnancy. So people and women who have a high risk to develop pregnancy, meaning they had a family history who had diabetes, had a previous gestational diabetes, or their mothers or sisters had also gestational diabetes, or even type 2 diabetes, they are more risk of developing gestational diabetes. And related to that, they will have high glucose levels and to cause this condition of diabetes. Now, there are much less common causes of diabetes. We call them inherited or genetic diabetes, which are because they could develop because of some genetic mutations in the insulin action or insulin release from the pancreas. And these people also would develop some sort of diabetes. And these are very rare causes, and you usually see them in families where they run this genetic mutation in several generations. There are also diabetes that could develop because of a medical condition or because of a therapy. People who tend to use steroids, we call them cortisones, which are a medical therapy to treat several medical conditions like bronchial asthma, several rheumatological disorders like rheumatoid arthritis or lupus. So these medical conditions, a lot of them, or MS or multiple sclerosis, a lot of these medical conditions could have steroids or cortisol as part of an initial or a important part in their therapy. And using this cortisol for big doses or large doses for a long period of time could induce a state of hyperglycemia or elevated glucose levels, and that will end eventually to develop diabetes. There are some medical conditions also can develop diabetes. People who tend to get transplants like lung transplant, heart or kidney transplant, because they are put on certain medications and because also of their medical condition can also induce diabetes. So these patients are very important for them to follow with a regular physician to predict the risk of developing diabetes in these patients. What I would like to also to tell you is that it's very hard to identify someone who has diabetes because a lot of times diabetes do not have symptoms. Some patients, or some people might have symptoms like increase in thirst, urination, some having problem with wound healing, dizziness, tiredness, weakness. Some people might have no symptoms at all. Some people might present with urine infection. Some actually even present with complications of diabetes that they develop, unfortunately, a heart condition like a heart attack or angina, we call them, or tightness of the blood vessels of the heart. So what we'd like to tell people is that you need to be screened for diabetes, even if you don't have symptoms. If you are older than the age of 40, or having a family history, or one of your family members, close family members have diabetes, especially type 2 diabetes, or you notice yourself that you're gaining a lot of weight, you're consuming a lot of calories, and you're not really exercising. So this is a very perfect time when you try to see what is your risk of developing diabetes and how to predict happening of this medical condition. Because, and we'll try to talk about it later, is that treatment of diabetes early saves you a lot of health and improves your health a lot. It saves you a lot of complications. So this is very important to do in people who are at risk for diabetes. And we live in a community, in the world now, that is, we use the modern life a lot. We don't consume a lot of, use a lot of exercise and consume a lot of food, unfortunately, and this is all puts us at risk of developing diabetes. We should save life and save health.
We are creatures of habit. Now, almost automatically, we choose to eat certain things or work out or not, almost out of instinct. It's not like we take conscious decisions. Now, in The Power of Habit, Charles Duhigg said that we cannot extinguish bad habits, we can only change them. Now, with that, it's very important, and to help our children out, we teach them good habits from a very young age, rather than letting them delve into bad habits that may be bad for their health. And so, just keep that in mind and become very good role models for your children. Teach them from a very young age to grab that apple, take a bite out of it, and to go on a jog.